Good afternoon, everybody. Good afternoon. I want to thank you for being here today on the second beautiful day in a row in Louisiana. I want to thank some folks who are joining with me today, who are up here. And I'm probably going to miss some, and I apologize in advance, but we've got Larry Oye, the Chancellor of the LSU Health Science Center, Ron Dew and Joe Donchis of the Nursing Home Association. I've got members of the Transition Committee on Health Care that work to help us transition the administration in that area. From the Hospital Association, I got Paul Salas. John Moeller from the Louisiana Budget Project is up here with us today. Rick Fern from the Children's Hospital Together Louisiana is represented. Miss Alma Stewart is here today from the Louisiana Center for Health Equity. We've got Randall Johnson from the Louisiana Independent Pharmacies Association. Jeff Drozda, the Louisiana Association of Health Plans. We've got leaders of Bayou Health Plans. And we have patients here today who are going to benefit from the expansion of the Medicaid program. And they are over. Today I'm here to sign an executive order, and as you might have imagined, it's my first, to expand health care to hundreds of thousands of Louisiana working families. Because of the previous administration's refusal to expand critical health care services, low-income adults suffered without health care because they were too poor to qualify for subsidized care on the health insurance exchange, but made too much money to qualify for Medicaid. We are consistently ranked one of the poorest and unhealthiest states. This cycle will not be broken as long as any Louisianan has to choose between their health and their financial security. We do not want to continue to send our federal tax dollars to Washington to then be given to 30 other states to help their people who need access to quality health care while ours go without. We want to bring our federal tax dollars back home to Louisiana to help us ensure healthier outcomes for our people. This executive order is but the first step in a new and better direction. Expanding health care means that once expansion is up and running, adults who would not otherwise qualify for Medicaid and who make at or below 138% of the federal poverty level are eligible for health insurance coverage under the Medicaid expansion. What this means is that adults who make up to $16,242 a year as an individual, or up to $33,465 for a family of 4, would be eligible for Medicaid coverage. By July 1st, we expect more than 300,000 hardworking citizens will have the comfort and security of health coverage. This will not only afford them peace of mind, but also help prevent them from slipping further into poverty and give them a fighting chance for a better life. It's also the fiscally responsible thing to do. Already, by failing to expand Medicaid under the previous administration, Louisiana has lost the opportunity to receive over $3 billion in federal health care funds. With Medicaid expansion, Louisiana could realize additional state general fund savings of over $100 million through fiscal year 20. Beyond that, Medicaid expansion will help to lessen Louisiana's budget crisis and will keep more of our federal tax dollars here at home. Most importantly, Medicaid expansion will provide access to quality health care and results in significantly better health outcomes for the working poor. And while we focus on the individuals who would benefit, because that is truly the most important thing, our providers also need to make sure that to the maximum extent possible, when they provide care, that they are reimbursed for that care. And if that's not going to happen through the Medicaid expansion, when the DSH reductions happen, and as we all know, DSH reductions is the primary way that we fund the safety net hospital system, there is no way to make sure that these providers stay open and solvent and strong enough to take care of people who come through their doors, whether or not they are poor, uninsured, on Medicaid, or otherwise. So this is also a step in the right direction to make sure that the providers remain able to take care of the citizens of Louisiana. I am very thankful to Dr. Gee for her commitment to equal opportunity for health care coverage and the assertive role she has already played within the Department of Health and Hospitals in prioritizing and ensuring the success of this expansion. And as far as I'm led to believe, now is the time to sign this executive order.
Down the front, guys. I want to thank the many members of the legislature who came up today to be present for this event. And at this point, I believe that it is time for a few questions. Sue Lincoln.
Governor Edwards, will you be presenting a copy of this signed executive order to the president when he comes on Thursday?
Haven't thought about it. I might do that. I really, certainly, it will be a topic of discussion as he and I visit Wednesday night, tomorrow night. And so we will discuss it because I will be asking for as much cooperation as possible out of the Health and Human Services in Washington, which I've already had a visit up there, and Secretary Earl has assured me that is will be forthcoming. Yes, sir.
Is there any possibility for higher Medicaid reimbursement for the providers?
Well, I can't make a comment on that. These providers in here certainly hope so. Yes, sir. I've got a little harder here than you guys.
Sorry, do you expect the legislature to throw up any roadblocks to the implementation of your executive order? I spoke to a member of the House yesterday who said he was going to try to do so.
I don't suspect there will be a few members of the House who will try to do that. I don't believe they will be successful. There was not a single campaign promise pledged to the people of Louisiana that was more integral to my campaign than expanding the Medicaid program. I let the people of Louisiana know why I wanted to do it, why it was in everyone's best interest, why it was simply the right thing to do. Following that discussion, I got 56% of the vote. I believe we will have the Medicaid expansion in place come July 1st, so that these individuals that we've been talking about here today will have that Medicaid card and they can access services through their provider. Yes, ma'am.
Good afternoon, Governor. Are you hoping that this will encourage people who make enough money to buy insurance but have not to get insurance as the January 31st deadline for coverage of?
Well, first of all, I hope that everybody, no matter what avenue they have at their disposal, will find a way to get health insurance coverage. It's just too important in 2016 for individuals not in health, especially if there's a program out there that allows them to have that coverage, and the security and the peace of mind that comes with that. This should be followed by better health so that they can be more productive citizens, better workers, and have a higher quality of life. So I certainly would hope so. I have no idea whether this instrument will actually encourage that particular universe of folks. Yes, sir.
Are you asking for any waivers?
First of all, this executive order allows VHH to go through the normal rulemaking process to exchange the eligibility with ask for waivers initially, but there will be waivers that we will ask for as a follow-up, which is a way that we can go about moving forward in the meantime, but getting the waivers after that. Yes, sir.
Are you using any of the fast lane methods for speed of enrollment, making it more efficient that they use to provide help?
I can't speak to fast lane methods. I can only tell you that Dr. Gee already has a plan in place to bring on the folks that we need and the consultants that we need, the technology that we need. Not only does she have the plan in place, we know what the price tag of implementation is going to be in the current fiscal year, and she has already secured pledges from providers to cover the state's portion of that cost, so that for the remainder of this fiscal year, there will not be a net cost increase to the state of Louisiana to prepare for expansion, which will occur on July 1st. Yes, sir.
Some critics on top too, they say, why do this when it is going to cost us money, after first 5 years you step down and pay a little bit more on the state match? What is the cost benefit of us paying?
Well, first of all, the cost is borne by the federal government for the rest of this year at 100%. It gradually steps down to 90%. 90% is better than any match rate we get for any other program for health care. And you have to remember what I said earlier. It isn't as if maintaining the status quo is even possible. When the DSH reductions happen, and they will, there is no way to deliver health care that doesn't have the Medicaid expansion as a critical component of our plan. And in fact, the business plans of hospitals around the state, and especially the partner hospitals who are running our charity hospital system, our safety net hospital system, I should say, they also call for the Medicaid expansion. There is no way to make this work absent that. Yes, ma'am.
In terms of the staff, Dr. Gee has said that she needs to hire an estimated 250 more people to do the enrollment for these
I think
folks.
the number's 248.
Right. So what's the estimated cost that you said providers have agreed to pick up? And then do you have concern about the staffing levels being in place in a quick enough fashion in order to get people enrolled for this July 1st timeline?
Well, it is an aggressive timeline. If we don't quite get them all signed up by July 1st, it'll happen very soon thereafter, but that is certainly the plan, is to have this ready by July 1st. The 248 additional workers will cost the state an additional $1.3 million this year because of the match that we get from the federal government to do the implementation. The entire cost to the state of Louisiana is about $2.8 million, but that includes everything that's required for implementation to include new technology and that sort of thing. That $2.8 million is what I'm talking about. We have pledges from providers to cover that cost for the rest of this fiscal year.
Well, but what's the mechanism for them doing that? How can, do they just hand money to the state, or do they take a reduction to their payments?
They're just going to write a check.
And who is writing a check?
The providers that have agreed to do this, and we'll get you that information as to who
So,
they are.
just quickly, it's called outstationing workers. So what they do is they write a check to us, and the state pays a salary, will be in their facility. So that way people can get enrolled into healthcare right there where they're getting care. You go to an ER, you can enroll for insurance there if you're underinsured or uninsured, instead of having offices separate. So it's something we need to work out with the federal government, but basically it's an in-kind it's a donation of money towards the salary of folks who will be enrolling people in healthcare.
Governor, can I ask one more question? Your predecessor, somewhat famously, had a philosophical aversion to big government. This is obviously part of what he would consider a big government program. It's the reason why he proposed it. Can you talk about how this comports with your philosophy about what government should look like and what it should do?
Well, first of all, I believe government has a role to play in improving people's lives. I happen to think it's a conservative thing to get the benefit of your tax dollars. Right now, we are paying tax dollars to Washington that would cover working poor in Louisiana with respect to the Medicaid expansion that are not coming back to Louisiana. So they're not benefiting our working poor, nor are they benefiting our providers. And so there is nothing more conservative, in my opinion, than making sure that when you do pay taxes, that you get benefit from that. Secondly, with respect to the general philosophy, I will just tell you again, this is no secret to the people of Louisiana that I was going to be elected and expand the Medicaid program. And in fact, all four major candidates running for governor expressed some support for expanding the Medicaid program. So I don't look at this as some revolutionary thing. This is just simply the right thing to do. And there are 30 states that have done this. 14 are presided over by Republican governors. This is not a partisan thing either. This is not right versus left. This is right versus wrong, and today we're on the right side.
All the folks will be covered, reading about it or seeing on TV tomorrow, this afternoon online and social media. I mean, what do they do next? Do they say, I qualify, where do I go? What do I do? When can I do
Well,
it?
that is part of the process that we're going to stand up and we will go through between now and July 1st. A lot of these individuals, in fact, I think Dr. Heath mentioned a while ago when she spoke, a lot of these individuals are already receiving some services from the state. We know who they are. We already know that they qualify. We will be communicating with them that will be the easiest group to target and actually communicate with. And then there will be others out there. The good thing that we have is we have the experience of 30 other states now. And we have a Health and Human Services Department in Washington, D.C. that is ready to help us. So we're going to benefit from the experience of these other states. And we're able to call upon that experience of people around the country, but particularly in Washington, have been very, very helpful already in trying to make sure that we are successful, that we can do this in the most cost-efficient way possible so that we can benefit the people of Louisiana as soon as possible. Another question?
Governor,
Well, you've already had a bite at the apple. Yes, ma'am.
Well, emergency rooms reopened. If you only have one and I lay you the lake, it seems like to me you need a lot more than that.
Well, I can't tell you whether or when that will happen. I can tell you that it's my hope and expectation that when we go through with this expansion, and there are far fewer patients going through those doors without reimbursement attached to them, that there won't be the need to close emergency rooms going forward. That's part of the thing that I was talking about a while ago. This isn't just about the individuals, it's about the providers. And when a provider closes its doors, it doesn't just close for the poor, it doesn't just close for the uninsured, it doesn't just close for the Medicaid population, it closes for everyone. So the nearest hospital to where you are sitting right now does not have a functional emergency room because too many people were going to that hospital who could have qualified for health care coverage, but they didn't have it. The hospital didn't realize the reimbursements, and they have closed the doors. If you think that won't play out around the state, especially when the disc reductions start, think again. Except it won't just be emergency rooms. It'll be the entire facility. This is the right thing to do. This is not even a close call. This is a great day for the state of Louisiana.